Hi class, welcome to Module 8, your last one before spring break. So as we get this together and you're thinking about healthcare systems, we've walked into the United States system as we start really exploring what our healthcare looks like versus other issues of healthcare. Now, what does sociology care about this? A lot, because as we focus on those social organization, healthcare is a major one in this country. And there is a lot of argument back and forth, and there's a lot of issues related to social problems. So we'll focus on those major issues of the healthcare system. Remember, we were once the top healthcare provider in the world. Today, we face many concerns, not only about costs, but about advances and what happens within the system. Now, I'm not going to focus a lot on the PowerPoints this week because you've got some really good videos, most of them being very short, that will be covering a lot of this topic and giving you even more information than your chapter gives you. So let's move over to the PowerPoints very quickly. So insurance, it's been around for a while. The company store type philosophy that your employer provided your health care, that local person. But prior to that, healthcare was fairly reasonably cost. You paid for it on your own. You would exchange a chicken for your care at the doctor. And we start seeing the development of big insurance coming into place in the 1930s with the development of Blue Cross and Blue Shield. Um, and we see those build as we look at insurances coming into place. Now, insurances are very, very different depending on what policy you have or what product you're using. And some are very much tied to um, health maintenance organizations. Now, these became very popular as we start to see the system becoming expensive, but health maintenance organizations were designed to provide affordable care for families. They give a salary to doctors, and doctors are to monitor for unnecessary care that people were seeking on their own that insurance was paying for. So there are significant things that come into place as we start looking at this. Not only do we have health maintenance organizations, but we also have PPOs, physician provider organizations, where people who are part of it, you pay less for. And if you go outside your networks, you're paying more. So there's significant issues within that. Some very interesting things as we start to explore what happens with the system. Insurance becomes very expensive, and we're worried about it, and many people don't have it, not mandated in this country. We don't have national health care. But the government steps in the 1960s and creates Medicare. It replaces aid for the aged. Actually, Medicaid replaces that along with Medicare. But people over the age of 65 are permanently disabled for 2 years, can qualify for Medicare. It is an entitlement system. In other words, you put in the money to through your checks all these years to get Medicare when you turn 65. Medicaid is primarily for people who are poor, so that we see it tied to TANF, which is temporary uh, for needy families, temporary assistance for needy families, which replaced ADC. And we see it tied where people who receive SSI, which is Social Security Insurance, and Social Security disability can qualify for Medicaid based on their dollars. Now, this is a welfare type fund, which is different than Medicaid. There are some in-between types of funding that we're not going into as we start looking at the system. Most hospitals in our country and were for profit, not nonprofit. So there's a rise of the commercial insurance being for profit, so Blue Cross Blue Shield, other forms of insurance that you can think of, Aetna, Cigna, all of those are for profit, and so there are real issues as far as their investors getting paid back. People pay individual premiums based on the individual risk, and these insurance companies want to avoid insuring unhealthy people. So lots of issues within that, and so we have the issue of pre-existing condition coming into place, and who can be insured and who can't. Managed care revolution came along. Insurances felt that they were paying too much and there was not enough care, and who was getting admitted. So there was this negotiation to managed care. And managed care ties to the same time that Medicare and Medicaid have come into place, and the cost is growing high, and the government is putting on restrictions called DRGs, diagnostic related groups, that jump in and look at the price schedules and say, okay, you get paid this much if you have pneumonia, and you can stay this many days in the hospital. And if you go over that many days, guess what? It's the problem of the hospital, or we've got to find out more diagnosis. The United States healthcare systems becomes very, very complicated. And so this managed care system rises into place in response to the increasing healthcare costs. Now remember, in the 1960s, we start doing open heart surgery, we start understanding things at higher levels, we're more responsive to chronic illness, and we're talking about the rise of chronic illness by the longevity of the lifespan here. And so managed care itself has little impact on healthcare, and there's backlash against this managed care look. So we attempt to explore this issue of what the healthcare exists within the United States. So just a precursor before you get into some of these videos. So we're trying to control costs. We're trying to get everyone covered. We start to move forward, and under the Clinton administration, we look to try to pass a Healthcare Security Act, and it fails. A national health care plan in place, and it fails entirely. But we do pass state children's health program. Now notice, you never hear it called that. It's actually called CHIP. And so if you've listened to the arguments recently on the news, you know that CHIP was not funded, and it was part of the last government shutdown, this negotiation to fund the children's health program. This allows for extended coverage of children when they are above that level qualifying for Medicaid, but their parents don't have enough, that it gives that in between those working poor children insurance when they may not have coverage for other, and it extends that coverage for that under 18 population in hopes to increase their health. Now, the Affordable Care Act went into place under the Obama administration. It was passed in 2010, and I remember when it passed, and I got a hold of the bill as it passed, over 1,000 pages, and I read it from cover to cover, and even by the time it finally went into effect in 2013, there were so many changes you couldn't keep up with them. But the goal was to work with the system we have now, the private insurers, and make them part of a national plan. Now, it gained support from the stakeholders. It worked with this existing neoliberal system, this capitalistic system of insurance, and it mandated that every individual have insurance, and you have to report that in your taxes when you go forward, and in ordered employers to provide insurance. It had limited funding put into place for it, but it taxed over the healthcare industry at a higher level to pay for some of this. So, real interesting issues as you're looking at this. So, let's talk about what's occurred. In the process, the Affordable Care Act, or Obamacare, has actually been successful at decreasing the number of people without insurance. Very important as we look at that issues coming in place, yet we still have this continuing healthcare coverage crisis. The U.S. is the only developed nation that does not guarantee healthcare to its citizens. Millions of Americans remain uninsured, 10% of the country, which is smaller than we've ever had before. And the Affordable Care Act remains on a for-profit model for the insurance companies that provide care. Now, uninsured Americans, 54 million Americans are uninsured before the Affordable Care Act, and you notice the reduced number of uninsured that have come into place. Cut it nearly in half. Those that are uninsured, even today, still fall in these categories. More likely to be young, childless adults. That's you in college. That's you after you finish school. They're more likely to be African American and Hispanics, and we can see Native Americans still tied to this. They are the poorer people, and they're more likely to be living in the South. So what are you going to look at within this process? Lots here. And both of these are fairly short videos, but just a picture from the economic standpoint of, from the viewpoint of the healthcare system in the United States. We're going to look at healthcare systems in other countries. And this is the first of their series, you'll see, just going over the U.S. health system, and we may be looking at some of those related to other countries like Canada, Japan, Germany, and other systems out there especially. The economics here is a little 9-minute video from PBS, the crash course videos, and it will explain some of those economic pictures at a higher level. This particular video, Health for Sale, was a video that I previously showed when the university had Films on Demand. Really, I'm giving you just a clip of what their video is about, but something to think about related to the high cost of healthcare in the United States and across the world. So a little 4-minute clip, and then finally information on the Affordable Care Act. Is it working? An update as we start looking at the changes. Now, think about this whole course. Healthcare is changing rapidly. We know that the government has pulled funding. They want to defund entirely the Affordable Care Act. They want to remove it. They have just passed some parts to remove pieces of the Affordable Care Act, such as requiring people to have insurance. So everything you're learning here, as with all sociology, is rapidly changing. And so staying current with what's going on will help you better understand this situation and what happens to people when they don't have the access to health care. So let me close with saying that you're going to see more changes come through, and it will be an interesting discussion as you move forward to your discussion question this week, which is health care a human right? Should we be responsible for providing it? What should be going on? And what are the results when we fail to do so? It's interesting as you start to explore that particular issue. With that said, I hope you have a wonderful break and that you're looking forward to coming back to more of the class after break. I also want to remind you that your research paper is coming due in a few weeks after we get back from break, as you can see here, and make sure that you have watched the video on how to write a sociology research paper. I expect you to follow that. Look at the guidelines for this particular paper. You have them available to you, and what the expected length is it should be no longer than 15 pages, no shorter than 12. You also have that information in video format. So looking forward to what you're bringing forward on your healthcare issue related to sociology. Have a great break.